Hello everyone, and welcome to another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. If you have a child that is anxious or depressed, you are not alone. An article published in the Journal of the American Psychological Association in January of this year discussed what parents, educators, and psychologists have been concerned about since the COVID-19 pandemic began over 2 years ago. The article is entitled, "Children's Mental Health is in Crisis. As pandemic stressors continue, kids' mental health needs to be addressed in schools." In a 2020 survey of 1,000 parents around the country, facilitated by the Ann and Robert H. Lurie Children's Hospital of Chicago, 71% of parents said the pandemic had taken a toll on their child's mental health. And 69% said the pandemic was the worst thing to happen to their child. A national survey of 3,300 high schoolers conducted in spring 2020 found close to a third of students felt unhappy and depressed, much more than usual. Mental health crises are also on the rise. According to the Center for Disease Control, from March 2020 to October 2020, mental health-related emergency department visits increased 24% for children ages 5 to 11 and 31% for those aged 12 to 17 compared with 2019 emergency department visits. What is the East Brunswick Public School System doing about it? Plenty. Joining us is Danielle Blalock, Supervisor of Health and Wellness for East Brunswick Public Schools. Danielle is a graduate of East Brunswick Public Schools, completed her undergraduate studies at Seton Hall University in special education and elementary education, her graduate work at Monmouth University in school counseling, and received her administrative certificate from New Jersey Excel. In addition, she's an adjunct professor at Kean University, teaching in both the school counseling LPC program and clinical counseling programs. Danielle will be sharing timely information about the challenges to children's mental health caused by the COVID-19 pandemic, early warning signs, and local mental health resources the East Brunswick Public Schools and the Township of East Brunswick have available to support the mental health of our kids and their families. Danielle, welcome to the Wellness Spotlight.
Thank you for having me.
Tell us a little bit about your background and your current position in the East Brunswick Public School System.
Okay, so I am the Supervisor of Student Services, Health and Wellness, which covers a broad spectrum of things. I supervise the school nurses. I'm the COVID coordinator. I supervise our student assistance specialists, which are our feelings teachers in the younger levels, and the emotional support counselors at our secondary level. I'm the 504 coordinator for the district, the HIB coordinator, which is harassment, intimidation, and bullying, as well as the homeless liaison and the DCP&P liaison. So it encompasses a lot of different things, but good work for our kids and our families. And my background was originally in special education. I started as a teacher, special education teacher, and then I went back to school to become a school counselor. I was a school counselor at Hammersholt Middle School for about 8 years, loved that job. And when the time was right, I got my supervisor certificate, so now I'm supervising the department.
You know, for the first time, probably ever, there are kids that are entering the 2nd and 3rd grade not having gone through the grades as most children have gone through.
Correct.
Have you noticed a difference in these kids that are just starting out in person in the public schools compared to other children that went through the grades in the traditional sense?
Absolutely. The idea of online learning that we were forced into has really impacted our little ones in terms of their developmental milestones, in terms of being able to relate to their peers, solve conflicts independently. I think we probably took for granted the time that play really influences our little ones in terms of their ability to figure out how to read social cues and figure out how to resolve conflicts independently. So a lot of our little ones have come into this school year lacking some of those school readiness skills that they would normally have gotten just through natural play and socialization with peers. Additionally, because of the mask wearing, which was necessary, of course, but the ability to read facial expressions and kind of understand those unsaid things that we come to learn and know about that are obvious to people on their facial expressions, our little ones really had a hard time understanding that. So we've had to do a lot of direct teaching and direct instruction as it relates to school readiness skills, mind, body, and eyes, how to keep your body still, how to focus, how to be a good listener, as well as social conflicts with kids, how to express your emotions, how to identify your emotions, and how to then regulate your emotions instead of having an inappropriate reaction or a meltdown or getting too upset, how to describe how you're feeling and be able to get the help that you need to work through whatever that emotion is.
That's excellent. It's got to be challenging for teachers to not only keep up with their current curriculum, but also now be saddled with this additional material that they need to present to the kids and help them learn. How do they grow their capacity to be able to do that?
That's a great question. East Brunswick public school teachers, thank goodness, are phenomenal educators. They are flexible in their thinking and have really had to adapt to the needs of the students. That's what we're always going to do, is be adapting. We're not going to stay rigid in our practice if it's a practice that's not working, right? So we've had to incorporate a lot of social and emotional learning practices throughout the day, incorporated within the academics. They do a lot of class meetings and having discussions where, as issues come up within the classroom, they can address it as it's happening real time, as well as they can lean upon the student assistance specialist to help come into the classroom and assist with lessons on those social and emotional topics that we're seeing pop up within the classroom environment.
Danielle, when it comes to the early signs showing a need for emotional help, do you notice a difference between those early signs demonstrated by children as compared to adults, or are they the same?
One of the things we always tell our teachers and our staff, as well as our parents, is you know your kids the best, you know yourselves the best. Be on the lookout for changes. We talk to our teachers about noticing if a student in the classroom is presenting differently, whether they're more tired than usual, not participating as much. If they're acting differently, it could be an indication that something is going on. So at that point, we always want to explore that to see if there's something that perhaps they need some assistance with.
What are some of the early signs in children that parents and educators need to be aware of?
That's a good question, and it's a wide range of things, from acting out behaviorally or crying often, an increase in anger or frustration, that frustration tolerance being less and getting agitated more easily. In some of our older ones, it could be things like sleeping more or not wanting to engage as much in interests or activities that they would normally participate in. So it really could be a wide range of things that are different from their typical behavior.
Well, how would parents know to distinguish between a normal adjustment to school and anxiety or depression or mood disorder?
Right, that's a great question. And I think if a parent has a concern, it's super important that they reach out to the school, be in communication with us so that we can look into it. If there is something that's going on that we should be concerned about, we want to address it right away before it escalates and gets to a point where it's starting to impact their daily life.
How would that work? I mean, if they notify the school, who do they speak to? Who do they ask for?
That's a good question. So a great point person is always the classroom teacher, especially with the little ones in the elementary level. Once you get up to the secondary level, your point of contact is probably your school counselor or your student assistant specialist. So each child, grades 6 through 12, is assigned a school counselor as well as a student assistant specialist who follows that grade level of children in the secondary schools. So they are a great resource. And if a parent has a concern, something just doesn't seem to be sitting right with how their child is behaving or presenting, it would be great for them to reach out, explore it with the school counselor. They can reach out to the teachers, see if we're seeing anything different in the school as well, get some feedback, and then really work through a plan of how we can best support that student as well as their family.
Do the issues that the children are demonstrating come from picking up what's going on with the other kids in their environment, or are they bringing it into the class from picking up what their parents are going through?
So kids always feel when the adults surrounding them are stressed. And I think COVID has brought a tremendous amount of stress to all of our families, whether it was a financial stressor, whether it was it caused grief within the family. It definitely,
people lost loved ones.
Yes. Unfortunately, there was a lot of loss. So I think that kids always pick up on that and are aware when the adults and the safe people in their lives are experiencing stress, and they do carry that. But in addition to that, I do think that our social media and our kids' exposure to things on the internet and social media we're really starting to see the impact of that as well.
When we were kids, we used to pray for snow days.
Right.
If you got sick and you couldn't go to school, you were almost celebrating. We didn't want to go all the time.
Right.
Have you noticed a difference in the kids now that they're back and they've been out of school and have been at home for all this time? Has there been a change in them?
Absolutely. When we first went out on virtual learning, I even remember my own children thinking, wow, this is great. 2 weeks at home. We get to do our work from our bedrooms. And very quickly, we started to see that excitement was very short-lived. Everybody likes a little break, a little change. But once we got into months long of that system, and then even into the next school year where we were able to go into a hybrid of being in person, our kids were so eager to come back into school. And actually, when they first were coming back in and we were acclimating kids back into the building, they were so thankful and grateful to be back to normalcy and routine and exposure to peers and teachers and activities. They, I think, had a newfound appreciation for school and for the things that were everyday mandates that were taken away from them. And that really did impact their growth and their ability to socialize and have kind of that just normal childhood.
What's been the effect on them academically, Danielle? Was it better for them learning at home, or was it better for them learning in school, or is the hybrid model better?
So it really depends on the student. Some students really thrived being at home if they had a scenario where it was free of distractions, they were able to really focus and participate. Whereas some other students, if they were in a home maybe with multiple other children in the house that were doing virtual learning at the same time, being on different schedules, it being noisy, perhaps the Wi-Fi not always cooperating, it did present its own challenges. It was not ideal, it was not what we wanted to do, but I think we made the best of it. And the students that did fall behind a little bit academically, they are able to get more intensive supports now in order to catch up and get them back on the right track.
Are there more age-specific social or emotional problems that we should be looking for?
I would definitely say at the secondary level, our older students, particularly 6th grade and up, depression and anxiety has been at the forefront of what we're seeing. That time that those students spent during COVID, where they were isolated, definitely had an impact on them. So anxiety and depression has been on the rise. I mean, not just in our corner of the world in East Brunswick, but across the nation, we're seeing a mental health crisis with our adolescents.
Danielle, has there been an increase in substance abuse, suicide, and child abuse as a result of the pandemic?
Yes, we have definitely seen an increase in all of those. In terms of substance abuse, the trend that we are seeing in the schools is vaping marijuana. That seems to be our biggest area of concern. We do screen kids that we suspect are under the influence, and if their test comes back positive, they work with our student assistance specialists to try to address the presenting issue, develop some better, healthier coping strategies, because you cannot be under the influence of marijuana in school, obviously. In addition, suicide assessments, risk assessments, as well as suicide attempts have also increased, unfortunately. That goes back to the concern of the increase in anxiety and depression amongst our adolescents. So we have seen at least a handful of suicide attempts. Thank goodness none of them have been completed attempts, but we have seen an increase in both ideation, suicidal ideation, as well as attempts. In terms of DCP&P reporting, school officials are mandatory reporters. Whenever a student says something or we suspect abuse or neglect based on something they shared or something we're seeing, we do have to report that to DCP&P. It does not necessarily mean that a case is going to be opened, but that's for DCP&P to look into and provide supports to the family should there be a need.
Is there a change in coping skills now compared to the way kids were many years ago? You know, why is this happening now?
Yeah, I think that a lot of our kids have lost the ability to develop positive and healthy coping strategies, and it's something that we are actively teaching and working on in the schools, trying to implement more mindfulness activities, brain breaks, opportunities for deep breathing sessions, yoga, trying to teach them how to incorporate positive coping strategies as opposed to going to a negative.
Years ago, you just sucked it up.
That's right.
You know, and it seemed to work.
Mm-hmm. Mm-hmm.
Why? How come it's so prevalent now compared to years ago?
So I think one of the major changes that we're seeing impact children is the use of social media. If you talk to any child, probably 2nd grade, maybe even younger, all the way through 12th grade, getting ready to move on to the next phase in their life, the cell phone is a constant. It is always with them. They always have access to their peers, information. That instant gratification is part of their life now. And there's positives, of course, to technology and having that access, but I also think that it has impacted our ability to problem solve and process and develop those positive coping skills that we need.
What's been some of the biggest COVID-related challenges that the school system and teachers have had to address?
I think one of the biggest challenges for this year was when students would be placed on quarantine instruction because of an exposure. So having to contact trace, which was done by our nurses department, and then have to figure out when and if students need to be excluded from school and for how long. So then you wind up with a situation where you have half of your class in person and a good number of your students
virtual,
and having to make a program and create a way to teach to incorporate both of those groups has certainly been a huge challenge for our teachers.
Have you noticed whether or not being at home and learning has been an advantage or a disadvantage to these kids? Have they, now that they're back, do they have any makeup work that they need to do? Have teachers noticed that the kids are current? Or are they ahead, or do they need some additional remediation to catch them up to speed based upon what they've missed over the last 2 years?
So I would not say that they are ahead. If anything, there are gaps in their learning. So teachers are having to assess and figure out what skills did they not perfect, really learn well enough in order to move on. You know, in certain courses, specifically math, I'm thinking of, probably because my husband's a math teacher. If you miss certain skills, it's hard to then move on to the next skill, right?
They miss that foundation.
Exactly. So they really have to try to assess what concepts the students were able to really absorb and perfect during virtual learning, give them some extra support in that before they can move on to the next thing.
How does a parent or a student know that they're behind? And how do they get the help that they need before it's too late?
Right. So I think parent communication with teachers is essential. Parents have the opportunity to constantly be in touch with teachers, seeing how the student is performing in the classroom by going into the parent portal, which is available online. So at any time, a parent can log in and see how the student is currently performing. The teachers can go in and put notes if they would like the parent to know, you know, student missed an assignment or didn't perform as well as on this assignment. So I think that home-school communication.
What programs are in place that the East Brunswick Public Schools have made available to students and their parents to help with mental and emotional issues that are coming up now?
So our student assistant specialists and school counselors are always available for individual work, both with students as well as with their families. In addition, there's group counseling that is provided. We do a lot of needs assessments so that we can determine what the real needs are for students in each time period. So we don't want to just run a grief group or a social skills group or an anxiety group. We really want to find out from the kids and the families what they're seeing as the presenting issue. So we always do needs assessments, usually twice a year, to determine where we see the most need so we can provide those support groups. We also do a lot of push-in lessons, especially at the elementary level, when we're seeing if a teacher is reporting they're noticing a certain trend. Maybe there's some mean behavior that they're observing in the classroom. So we'll push in and do lessons. We use a social and emotional curriculum for our kindergarten through second grade students called Superflex, which really helps students to understand and be able to identify emotions, problem solving, conflict resolution, things like that. As they get older, there's tons of clubs and activities as well as groups. We have from 6th grade up our Sources of Strength program, which is my favorite. It is a
the Sources of Strength
Sources
program.
of Strength, yes. It is on SAMHSA's registry as a gold standard peer leadership program. It focuses on helping kids to develop positive coping strategies by utilizing things like counseling support, gratitude practice, medical care, things like that. They do a lot of work in the schools, even between grade levels. Our older kids that participate in Sources of Strength come down to our younger kids and teach lessons about inclusion versus exclusion. So that program, I think, has been a great influence, and it's a mentor program, so it has an equal amount of positive adults from the building in the program with our kids because it's a mentorship program, so it combines our adults with our kids, which having a positive adult in your life is a key factor in being successful. And when kids feel that they are connected to someone at school, their chances for being successful increase.
You know, it seems, thankfully, these days, people are moving away from psychotropic drugs for children, for ADD, ADHD, and also for depression and anxiety. And they're moving more towards natural approaches, like chiropractic care, nutrition, and things like that. What programs does the East Brunswick public school system have in place to be able to offer that kind of support?
Well, health and nutrition is always infused in our curriculum between our health courses as well as our PE courses. So that is definitely a focus that students hear about. But we have also started to incorporate a lot of mindfulness practices, both on a school-wide level as well as within the classrooms. So teaching skills such as deep breathing, how to do different types of deep breathing, how to take a brain break, when to know when to take a brain break,
Good.
Yoga, things like that we're trying to infuse and incorporate into the school community so that kids have the opportunity to learn how to utilize that.
For parents that have a concern, who do they contact? Where are the best websites to go to? What would you recommend?
I would recommend you call either your school counselor, your child's school counselor, if they are in grades 6 and up, or the student assistant specialist. All the information is available on the East Brunswick Public Schools website. You can search under student services or school counseling department, and you will find all the information you need there. Our school counselors have online Google sites, Google offices rather, that you can click into. You can request an appointment. You can always email your school counselor or student assistant specialist, and they will get back in touch with you to help support whatever the need is.
Thank you. Danielle, you've been such a help. I know to so many parents who have such concerns over their children, especially these days. There are so many reasons to move to East Brunswick, but one of the biggest, most compelling reasons that most people cite is our public school system. So I just want to take a moment before we close to thank Dr. Valesky and the entire administrative and educational staff of the East Brunswick Public School System for the wonderful work that you do in helping to educate our children, because it's so important, and also to keep them safe.
Absolutely. Safety, health, and wellness is imperative to all of us. I feel lucky to work for this district and have the support of the Board of Education in prioritizing mental health and mental health supports for our students. So it takes a village. We all have to be part of the process in order to raise healthy kids.
Thank you, Danielle.
Thank you.
This concludes another segment of the East Brunswick Advisory Health Council's Wellness Spotlight. I'm Dr. Ken Freedman, President of the East Brunswick Advisory Health Council, with Danielle Blalock, reminding you that wellness works when you work it.